Hi there, Marco and Cooper here at the National Rural Health Conference in Blenheim. Today I have Yvonne Boys with me, who is a nurse by trade and academic coordinator for the Rural Health Interprofessional Programme, which is run by the University of Auckland in Whakatane.
That's right, Mark.
Yeah. So thank you for coming to talk with us.
Pleasure.
And I think it would just be great to know a little bit more about what the Rural Health Interprofessional Programme is, and it sounds like something fantastic that there'd be a lot of students that would want to get amongst.
Certainly do. So originated 2012 in the Eastern Bay of Plenty with the support of the District Health Board and the University of Auckland. And so it's grown from, there was about 3 different professions then, and now 2019 we have 12 different professions and seeing over 300 students in the last 3 years. So it's grown from strength to strength. University of Auckland, AUT, Wintec, Toiho Mai, Awanuiarangi. So it's quite I think we've got 7 institutions that feed into our program in total. So the students come down on their elective times 5 weeks. So the medical students, they'll be, for example, in general practice. Nursing students could be in general practice or within the hospital or within some community or Maori hauora.
Okay.
Physiotherapists could be business physio or hospital, same as pharmacy. So it's the placement for the student doing their practicum time. So we have them more or less 1 day a week. We start off with a noho marae, and so which really grounds them into the Eastern Bay of Plenty culture with Ngāti Awa. Many students have never been on a marae before or stayed on a marae, so it's that experience as well.
Sure.
But that's the first time they've met each other because they've just arrived our way. Just stepping the truck back a little bit, that the students provided accommodation, and the only thing they need to pay for is food.
Right.
So when the students come from, say, Hamilton or Auckland, they come and they are into houses interprofessionally.
Yep.
So you might have medicine, nursing, physio, pharmacy living together.
That's
and so that's a
fantastic.
great opportunity. That whole interprofessional starts already with us, not doing anything. So we give them a period of 5 weeks with us, mainly in their placements, doing their clinical hours, but we organise different programs, thinking about that lateral learning. And the lateral learning is that experience learning. For example, we have Dr. Anna Rolliston comes to speak to the students on Maori health inequities and engaging Maori, but also she talks to them about their biases and gets them to look at themselves. And she gives wonderful examples of, as a female going out to catch an aeroplane up to Auckland, and that she sees 2 female pilots and resonates with the students and saying, wonderful, 2 female pilots getting up in the clouds, and then there's a lot of turbulence, so she's thinking, can this woman fly the plane? So she's trying to bring down her biases, and she speaks personally to the students like that. So they really start to think about themselves and how they connect with people. And she gives them a little bit of an exercise to do around a table, safe and back in their houses, to talk about their biases. Right. And so it's giving them examples like that, or family harm talk that comes with the family health team, social worker and a nurse, paediatric nurse liaison. So they work together as a team and talking about some of the case studies that they have that the students may see when they're out and about rural New Zealand. Just giving them different opportunities. I go to the kiwi fruit pack house, and it's a really good opportunity now. Students say, why are we going to a kiwi fruit pack house? Well, then you can see all the dust coming off the kiwi fruit, and that's why exacerbation of people's asthma.
And asthma, yeah.
Absolutely. So it's, and the migrant workers, the transient population, the health of the population. So you think about that lateral learning. Yeah. Also, we'll go to a dairy farm, and if calving time, they'll feed a calf, but then we have rural support come and talk to them on mental health rurally, what it means, rural New Zealand and the pressures of being rural, whether it be on a farm or whether it be a subsidy industry, So it's those little things that being together and learning different things and ensuring that the students go into placements where there's great support, but also that the connection and the growth of the student is so evident because of the opportunity that they've had. Yeah. I think the independence for the students is one of the things that I've seen over the years. I've only been connected for 3 years with the placement, the RHIP program, and the growth in the students themselves is huge.
Yeah.
Really good.
I did the medical immersion program, the full year one from Otago, and you couldn't beat it. It was
No.
just fantastic.
Yes.
And for you said it's 5 weeks, which is a snapshot, but it's something that they may have never got otherwise. So that might be the difference between them being a big wig subspecialist in Auckland compared to going, oh no, I'm going to go be a rural GP in Kaikoui.
That's right. So giving them that experience. And we're noticing Whakatane Hospital was bottom of the pecking order of new house officers. Last year we were at the top. Very proud that I think applicants for 230 something people for 6 places.
Yeah.
And in the talk I did yesterday, we had 3 of the new house officers talking about the RHIP program and how it made them think about rural New Zealand, what they could give back, but also good for themselves, and that pressure of, not being in a huge city, but knowing that they'll have to go there perhaps one day for some extra learning or whatever. But just, once again, I think being immersed into that culturally, the rural and cultural area for even a short time gets them to change their thoughts. Because there's a lot of free time. They'll connect with the beach or the tracks or the bikes or just the local quiz night and meeting local people. And so that's gives a really high opportunity as well.
Cool. Well, thank you very much for talking to us today.
Been a pleasure. And thank you for having me here.